Hi, this is Matthew Holt. This is the part two of my interview with Pete Hudson, who was the founder of iTriage back in the day, now the managing director at Alta Partners and an investor in Transcarent. We've talked a lot in the first part, which you'll see the connection to in the show notes, uh, and was published a few days ago on the healthcare blog. We've talked a lot about how things got there, how things got to where we are in digital health. In this part, we're going to dig much more into AI. We talk about transcarent wayfinding technology and generally see how we think the whole sector is going to evolve now that things like the iPhone and digital understanding of technology are more ubiquitous. And here we go with part two. So let's dive into the AI a bit more. As I mentioned, one of the things is it replaces humans to some extent, right? And a lot of the issues that we're dealing with in healthcare is always been a surfeit of demand, a lack of supply of humans, particularly skilled, humans, doctors, even nurses, even support staff of all kinds in healthcare, and an increase in demand and interest in some aspects, and to some extent, a failing of the healthcare system to really deliver, the sort of widespread preventative primary care that we've talked about for years that really hasn't, I would say, been a feature. Let your imagination run a bit and tell me, with the kind of AI that you're seeing now out there being used, obviously wayfinding with transparency is one example. What kind of possibilities does this get us to if you push out the envelope a few years?
Well, I think, when people think about AI, they jump ahead 20 years and they, think about the Terminator movie and computers, controlling everything, or the Matrix or things like that. And in reality, I think, um, AI should be applied today in ways that it performs better than human beings and better than your own ability to sort of search, click, and identify, an answer to a question. So, if you look at, and we'll get into wayfinding here with Transcarent, but one of the most confusing things out there, even if you're a doctor who invests in healthcare companies and knows all the payers and providers out there, is figuring out what your benefit structure is. Um,
Of course.
what's my deductible? Like, who's in network? Who's appropriate to be seen? Are they available? Are they near me? Are they open? What's their address? So all of that kind of, both administrative and sort of task-oriented healthcare access can be optimized very constructively with artificial intelligence. And the difference between a mobile solution of the past and something like this is it comes across as a human being. It meets you emotionally and contextually and linguistically in the way that you're used to getting answers that you trust because of that, one-on-one human interaction. And so there's a huge hurdle you have to get over, and that's you have to have the best information, you have to have the best processes, and you have to have trusted capabilities and great quality assurance and feedback loops within the system. And I think for an extended period of time, you need to have people watching and learning and making sure that systems are answering questions appropriately. But for a human being on a call center call, getting a call in from Matthew Holt, who wants to find out stuff about his benefit structure because he has knee pain and wants to get something done, that's going to take them a lot longer. And it's probably going to be less accurate because there's human error inserted all along the process. Now, if you said, hey, I have chest pain, what should I do? That's an area where the endpoint has to get to a human being. And you have to think about the risk of certain types of conditions and questions, and understand where technology should be applied and where it needs to interface with appropriate levels of quality and human interaction. So if you think about that, there's a lot of complexity that comes into the design of a system like this. And but the outputs are revolutionary. in terms of what can be delivered. You can ask with natural language all sorts of questions about what is going on with your health insurance, the payment expectations. You can also get sort of light clinical feedback and information. I was put on this medication. What are side effects? I have shoulder pain from an injury. Like, what are possible conditions that can cause that? All of these sort of workflow issues that patients have suffered from, for ages, right? What could I have? Where should I go? And what does it cost, or how does it interface with my insurance? And then how do I manage it in my surroundings? Those are all age-old questions. And so to have the ability to text, to communicate in, a language-friendly way, but get the kind of information back that's so valuable to the consumer is a next generational step for healthcare.
Yeah, I think one of the fact I wouldn't belittle the thing that it's 24/7. It's always there, and it tells you and it knows a ton of stuff about admin and healthcare in the Wayfinding Transcarent app. I'm interested in what you think is a lot of the sort of the AI, the model was built on the 98.6 platform which they acquired, which had all those messages between doctors and patients. You're clearly going to have a lot more of that text back and forth. There'll be a lot more knowledge, as it were, to be mined and modeled against. And obviously, you're seeing a lot of other data that people are starting to model against. I'd be interested in how fast you think, and maybe in which areas we're going to go to the point where the AI will do a lot of it'll be very like clinical now, but getting slightly more, and then supporting the actual clinicians online. How do you think that's starting to play out, and how do you think about that as an investor?
Well, thinking back on delivering care, a lot of the time involved in delivering care is collecting information and then, validating information. So if you think about that, that can be done, or a lion's share of that can be done, especially, with patients who communicate well, who understand and remember what they have, or systems that allow you to look at records. That can be done very efficiently without human interaction. Now, in many cases, it's going to need to be verified or sort of supervised or looked through by a human being that's making an ultimate decision. But that whole process takes an incredible amount of time. If you think about, all the guidelines for documentation that occurred back in the 90s and was kind of a driver for my first company, because people didn't understand it and they struggled with it. There's all sorts of different criteria that you have to hit to collect information to be able to deliver care efficiently and with high quality. And so a lot of that structured data collection can be done easily, and it can be done in a way that somebody feels like they're really having a conversation and getting asked questions that are relevant and meaningful at the same time.
So if you push it forward a little bit and say, okay, so now I have a single tool that I can talk to, text, talk, voice, whatever, and it can get to, get through a lot of my problems, and get me, to a person. And by the way, and then the MD or whomever the NP I'm talking to online, is kind of a natural sequence into, primary care or directing me around to the right appointment. So you got that, you kind of have. We all know the early chatbots. It was clearly, obviously, it's a chatbot can only say one things, and eventually would tell you, half of them would say, "Call this number." It wasn't seamless, right? But if you're saying we can now blur that boundary between what the technology can do and when it's to a human, and a human will be supported by technology, they may be using a similar tool in the background. Even if they're a physician using a differential diagnosis tool or what have you. How far do you think we go before that becomes kind of the accepted, understood way that people approach, care? Go back to the question of people calling you instead of using iTriage and why you started iTriage. And then my bigger question, is sort of the big picture investor question, is back to like who runs that, who controls it, and how do we, At what point does the management of the consumer become a sort of independent company? Does that get done by health plans and systems? But start off with the how close are we to getting there? You know, as a something that's understood the way that mobile phones are understood and AI is becoming understood. And then secondly, who runs that?
Yeah, no, it's a great question. And, I'm learning along with everybody else. I think
You'll have an opinion. I
it's
won't guarantee it to be right. You don't have to guarantee.
right. We do want to license your voice, as our interface. So we'll talk about that
Yeah,
later.
well, yeah.
As a trusted arbiter of information.
I'm absolutely sure that my voice is the best one.
Um, no, I think that joke identifies the fact that a lot of this right now is an interface, right? So it's an interface that, you know, at this point in time works for people to interface with technology as opposed to just structured data entry and, clicking a button here or there. It allows you to have free form conversations and it extracts information from that and gives you appropriate responses back. That's a huge thing. I mean, back in the day at Aetna, we were trying to create, take EHR data, take claims data, and then combine that with semantic ontology, which is a lot of the free-form data that's in both of, or mostly EHRs, but across healthcare, and then create sort of a single reference point of information. And it was the semantic ontology part that's the hardest. And so when you think about real-time semantics and being able to extract information from a question and answer effectively, it's an incredible, as I said, generational change in interface. Beyond that, like we're already seeing a lot of the benefits of really fast, highly efficient computing and data access that interfaces or integrates with that interface. So, you may ask a question that then is a very tough data question to answer, but data processing is fast now. We have all the pipes wired and integrations done, and so you can go get that information and bring it back, in an interesting interface back to the patient. So that's kind of first level. As you start to get more and more clinical data and you follow more and more workflows to success and to failure and to questions or QA, et cetera, you get more and more intelligence built into the system. And so I don't think you can just say, I'm going to go to a LLM or a AI company and I'm going to train it on healthcare. I think you got to be very in the weeds and thinking about it every day from a clinical quality standpoint, from an interface standpoint, from a data access standpoint. And that's why companies like Transcarent have such a lead in this space, because a lot of that was already thought about. A lot of that was built and started with 98.6, and a lot of the integrations and customers and pools of population within big employers are now customers of Transcarent. And so you have this great milieu of intelligence, capability, technology, supervision, maturity from a leadership standpoint to be able to understand what the challenges are and how to build into them for the future. So, I think there'll be more and more evolution beyond an interface for this type of technology. It will seamlessly interact with all sorts of different solutions in the specialty space, in oncology and pharmacy. I mean, if you think about how hard it is just to, get medication refills sometimes.
I've written extensively on my experience with Blue Shield and CVS, and not good.
Right.
Yep.
So, that the capabilities and efficiencies that this will create for the consumer, for the employee, and then ultimately for the employer, because, we're able to provide this, if you compare it to other navigation companies out there, which was a great idea for the time. Like, let's take some technology, let's create some point solutions, and then let's have Pete and Matthew on a call center answering phones and logging into whatever, point solution that they need to log into to figure out what the benefit structure and best advice is for the patient. That's inefficient. It's highly costly. There's a huge churn on call center people. And so the quality is a constant challenge. And every company I have with a call center right now, the call center is a challenge. So, if you're an employer out there and you're looking at a navigation service and it's highly dependent on a call center, like you got to think about other ways to do things that, and ultimately you're going to save money and you're going to have better service through, a wayfinding technology like Transcarent is providing. So, over time, like there's going to be a time when regulation and AI, have to, meet and connect and talk and come up with ground rules. There's already plenty of them, but there's going to be a time when some of the capabilities with AI are approaching or, going beyond what human capabilities might be. And then I think our society is going to have to decide what's best for our society. And that's a very difficult, loaded question for many people.
Yeah, we're gonna. I mean, there is some guidelines where there's some industry groups, there are some White House guidelines, and and then we're going to be challenged by what other countries do. I mean, there's no question that with the amount of presuming that we get the returns, the amount of spending that you see reflected in Nvidia stock, and the amount of activity that's going on, that this is a massive potential change, and it leads me to kind of my last question, which I kind of asked before, but let me ask it in a different way. So. Our friends at Andreessen Horowitz have often said they think the world's biggest company is going to be a consumer-facing healthcare company. Put that aside for 1 minute. We have a structure of, as we said, well-established hospital systems who've grown, big health plans who do what they do. You've known them from the inside and the outside, all of those. Do you think that there will be? Do you think this gets a tool that gets used and sort of is an intermediary between them, or do you think that a lot of the actual power, services, and activity that is healthcare spending comes into an organization like a Transcarent or a similar one that uses kind of AI to manage patient experience, kind of soup to nuts? Where do you think this goes?
Yeah, I do. I'm not investing in in payers right now, right? I think payers have an incredible business model, and it's really based on the longevity and the experience and the balance sheet that they're able to deliver, risk at scale, which is really, really hard. But and Amazon certainly has had its challenges and entry points into healthcare. I think healthcare delivery is different. Healthcare services are a whole nother spectrum of complexity. And, if you think about what they did, I mean, it was one of the hardest things ever, right? How do you buy from anybody and get it delivered, through all these different channels to you, at a competitive cost?
And the next day and now the same day.
Right. I mean, I can't even believe what I can pick out of a list and it shows up the same day or the next day.
I bought 2 chainsaws because I clicked twice the other day. And my wife was able to drop it off at Whole Foods and get rid of one. She just take it back. Incredible.
Yeah, incredible. The same opportunities will occur with healthcare. I think, there is a siloed data and service and integration challenge that is, more unique with healthcare. And so it's going to take the right type of people running this company that can find the advantages for a large multi-region health system or a large payer or an employer with employees in every state in the country. Like those are big challenges. And to have a consistent, standardized approach to, how you access care, how you get your questions answered, how you serve those members is really hard. And I think, it's been hard for payers to solve that in a way that really matters to their members and to employees and human beings out there. They do a great job at hey, pay for whatever might happen to me in healthcare, and we never know, right? It's we're human beings and disease is rampant, and it's a challenge every time you have something happen to you, because it's such an emotional and difficult process to navigate. But Transcarent has the scale, the size, the generational technology, the generational leadership, and already enough customers and members to build the kind of system that truly adds a platform value to these age-old questions of what could I have, where should I go, and why does it matter to me? What's the most efficient way to take care of my health? So, and there, within those questions are 1,000 different irritating work streams that we've all had to deal with.
Right.
And so, I couldn't be more excited. We've been involved since the seed stage of the company and participated in every level of financing. But the evolution that we've seen and the decisions that have been made to lead to where we are today have been, outstanding to see materialized. And having, being a sort of a tech geek myself, using every sort of new phone in the emergency room back in the day, and now, investing in what I hope is the best technology I can find, having gone through and done a demo and played with and gotten up to date and on the different iterations coming out with wayfinding, I can truly tell you I'm surprised how good it is, and very pleasantly surprised, believe me. But it's the type of information and interaction you can have with it already is pretty profound. So, as customers, you become partners, right? As providers, you become partners. And that's how you build that kind of next generation direct to consumer technology that is going to deliver everything and, across this siloed ecosystem of ours by truly having these large partners come in, both as customers, but also as contributors and beneficiaries of what we're building.
Yeah, I think my point is when I've used wayfinding and seen it, it's just like you would go, wow, it's doing some incredible stuff already, and just think what it's going to do in a couple of years. And then, I really think you've got an opportunity to do what I've been hoping, we've both been trying to do for too long now, which is, fix the consumer experience, which also, by the way, will fix the workflow experience for the clinicians and the provider organizations who've had to put up with the siloization and using 20 different systems and not getting data and all that kind of stuff. So I think the possibilities are fantastic. All right, well, that's my editorial. I've been talking with Pete Hudson. He is the managing director at Alta Partners, formerly the founder of iTriage way back when, nearly, not quite 20 years ago, but 15 plus years ago, and an investor in Transcarent. Pete, thanks so much for your time.
Thank you, Matthew. It's great to see you again.